Hi, this is Barbara Stevens, and today I'm going to talk to you about the swine flu virus. My regular physician called me to remind about me and my family members to get swine flu virus vaccination. It can be given in two options. It is through flu shot. It is an inactivated vaccine containing killed virus that is given in a needle, usually in the arm. The flu shot is approved for use people 6 months of age or older, including healthy people and those with chronic medical conditions such as asthma, diabetes, or heart disease. A different kind of vaccine called the nasal spray flu vaccine, sometimes referred to as LAIV or live attenuated influenza virus or flu mist, approved in 2003. The nasal spray flu vaccine contains attenuated or weakened viruses and is administered by nasal sprayer and is approved only for people healthy 2 to 49 years of age and who are not pregnant. Most of the patients have mild symptoms, but for some persons, to those higher risk groups such as those with asthma, diabetes, obesity, heart disease, pregnant, or have weakened immune system, in severe cases even those who are very healthy people, at about 3 to 5 days after the patient condition declines and can have a respiratory failures and will need or require an emergency treatment. Similar with other influenza viruses, it can spread through coughing, sneezing, or touching contaminated surfaces, and then touching the mouth and the nose. Signs and symptoms can last for a week, and like the seasonal flu that includes fever, sneezing, cough, headaches, sore throat, joint and muscle pains. To avoid spread of infection, you have to stay home, get up from work, get up from school, stay away from crowded areas and public facilities. Healthcare professionals can wear a mask, a facial mask, but Dr. Lauren Mascola of LA, Los Angeles County of Public Health's Director of Acute Communicable Disease Control stated that masks may give people a false sense of security, and Associate Professor of Medicine in USC Keck School of Medicine, Dr. Paul Haltom, stressed that masks should not replace the standard precautions. The early influenza epidemic are stated to affect 5 to 15% of the global population, though most cases are mild. These epidemics cause severe sickness in about 3 to 5 million people and about 250,000 to 500,000 worldwide. In industrialized countries, severe illnesses and deaths occur in the high-risk populations of infants, elderly, and chronically ill patients. Although this swine flu outbreaks differs in its tendency to affect the younger and healthier people. In addition to these annual epidemics, influenza A virus caused 3 global pandemics during the Spanish flu in 1918, Asian flu in 1957, and Hong Kong flu in 1968 to 69. And these virus strains had undergone major genetic changes for which the population did not possess a significant immunity to it. Recent genetic analysis that revealed that 3/4 or 6 out of 8 genetic segments significant of the 2009 flu pandemic arose from North American swine flu strain circulating since 1998, when a new strain was first identified in the North Carolina farm, and which was the first ever reported that with a triple hybrid flu virus. The great majority of deaths in 1918 flu pandemic were the result of the severe bacterial pneumonia, but the pandemics have had great many fewer fatalities now because of the development of the treatment for pneumonia, the antibiotic. People who contracted flu before 1957 appeared to have some immunity to H1N1, but Dr. Daniel Jernigan of the Center for the Disease Control has stated that the test on blood serum from older people before 1957 who were born before 1957 appeared to have some immunity to it, and they had antibodies that attacked the new virus. But that does not mean that everyone over 52 years of age had immunity to it, since Americans and Mexicans have died with the new virus already. And Dr. Joseph S. Brissy, the Center for Disease Control, Flu Division's Epidemiology Chief, and Dr. Michael T. Osterholm, the director of the Center for Disease Control, said that the swine flu pointed out that it's meaningless because the World Health Organization stopped keeping count of the individual cases and focused more on major outbreaks. I am interested in researching about the swine flu virus because it is a new and very different flu virus spreading worldwide. It can get worse and can cause several illnesses. And thank you for listening to my topic.